Assalamu alaikum guys, welcome back. Cataract, which is opacification of the normal crystalline lens that is in the eye, that can occur in different parts of the lens. Either the anterior side, posterior, in the middle, which is the nucleus, at the cortex, which is called the cortical. So we'll discuss all of these in detail. In this image, you can see the cataract has occurred on the anterior capsule. So it is known as anterior subcapsular cataract. If it occurs on the posterior side, it will be known as posterior subcapsular cataract. But if it occurs on the posterior pole, as you can see in this picture, then it is known as posterior polar cataract. And one of the interesting things about this is that the patient, the rest of the lens will be fine, but since the opacification has occurred on the posterior pole, these patients will experience photophobia during daytime. But when they go indoors at night, since the pupil dilates and the light can enter to the other parts of the lens, they will have no problem. So these people unfortunately have to undergo cataract surgery as soon as possible, because this type of cataract hinders their daily activities. Now let's come to nuclear sclerosis cataract. The nucleus is the center part of the lens. So when that gets opacified, that is known as nuclear sclerosis cataract. Now it can be divided into 4 parts: grade 1, grade 2, grade 3 and grade 4. Now it comes with experience. Usually people do get confused between 2 grades, so that is not a big issue. So you can see in these images, these are grade 1, grade 2, grade 3 and grade 4. Now let's come to cortical cataract. The cortex is the outer part of the lens. The nucleus is the inner part. When the cortex gets opacified, it is known as cortical cataract. Now remember, usually you will get a combination of 1 to 2 cataracts. Then you won't get a patient of just nuclear sclerosis or cortical. You will have a combination. So you can say it is nuclear sclerosis plus cortical cataract, or nuclear sclerosis plus posterior subcapsular cataract. Or you can get alone. It depends from patient to patient. Now these patients will come to your clinic with the complaint of haziness or decreased vision or blurring in the field of vision, gradually and painless. They will have gradual decrease, it will be painless in nature, there will be no floaters or flashes of light or any other complaint. Yes, they can complain of watering, redness, itching, but that is not association with cataract. So first most you need to counsel them that it comes with age. Yes, people who do have diabetes, hypertension, or if they get a trauma, they can get cataract at an early age, but it usually occurs in patients of 50, 60 years of age, and they need to undergo cataract surgery some point in their lifetime. First most, you need to do refraction on the patient. If the patient feels better with refraction with glasses, then they should use glasses. A time will come when the cataract will get so dense, or there will be so much opacification in the lens that the glasses won't be of use, spectacles won't be of use. Then you need to undergo cataract surgery. So this was all about cataract surgery. If there are any questions in your mind, please do comment and I will try to answer them. Until my next video guys, take care.